We've launched a report here today that talks about how militaries, particularly armed forces, can assist in the Healthcare in Danger project. The project meaning that we're trying to ensure that people who are delivering healthcare and those who are accessing healthcare in armed conflict can be better protected against attacks and against risks of attack. So what we've done as a result of this report is to gather together images and understandings from a 16-country study, as well as some bilateral confidential consultations with a number of countries around the world and the militaries of those countries, and a workshop which took place in Sydney in December 2013, where we gathered together over 20 militaries and representatives of those militaries so that they could talk about various areas where we need to improve how the armed forces are able to ensure that healthcare can be protected. There are three key areas, the first being checkpoints and how the militaries, who of course need to ensure that there are checkpoints for their security, still allow people to cross those checkpoints in order to get to hospitals to be able to be treated. The second area is armed entry into hospitals and medical facilities, trying to ensure that the entry that occurs into medical facilities is done in accordance with international humanitarian law. And the third is precautions in attack, ensuring that if there is an attack because of perhaps a misuse of a hospital, that attack is done once again in accordance with international humanitarian law. The report aims to ensure that militaries implement the practical measures which are outlined in the report to ensure that their armed forces know and understand both the legal framework but also the practical measures, the practical understandings that are required to ensure that people are adequately protected in delivering and accessing healthcare in armed conflict.